All across the American political spectrum, almost everyone seems to agree that prescription drug costs are too high.
We will never stop fighting for our children, our seniors, those in need of prescription drugs, and working families who cannot afford the escalation of costs.
The drug lobby is making an absolute fortune at the expense of American consumers.
But the big companies couldn't care less about the government's opinion. Gilead Sciences takes the prize among hated pharma giants. Its new medication for people who've been infected with HIV is selling for roughly $1,600 to $2,000 a month. Needless to say, there has been outrage.
We're here today at USCA to protest the Gilead's pricing of their new combination therapy, Stribild. There's no valid reason for it to be priced that high. It's purely greed and profit-driven.
Their new HIV drug, Truvada, brought in a whopping $3 billion last year. But they deserve to be compensated for their creativity and innovation, making a new product, right? Well, here's the thing. It turns out that it was actually U.S. taxpayer money that paid for developing the new drug. The scientific research and the testing necessary was all paid for by the U.S. government. However, it's Gilead's stockholders that get the profits. No royalties of any kind are being paid into the U.S. Treasury.
Essentially, we've identified that there's a huge problem with access to Truvada as pre-exposure prophylaxis, or PrEP, in the United States to prevent HIV infection. Basically, there's a lot of low-income communities, people of color, trans women who are not being able to access this drug, and a huge part of that is because the company that makes it, Gilead Sciences, charges $1,600 for a drug that only costs $6.
Now, there was similar outrage when Gilead started charging over $1,000 a pill for its hepatitis C drug.
A Gilead está tendo lucro absurdo em cima disso, em detrimento do acesso ao tratamento para essas pessoas, tanto infectadas com hepatite C como com as co-infectadas.
Now, there's another famous case of the chief executive of Turing Pharmaceuticals, Martin Shkreli, jacking up the price of Daraprim, an anti-parasite medication, 5,000% from its initial cost of $13.50. And when pressed in Congress to justify his reasoning, Mr. Shkreli seemed to laugh in their faces.
I want to plead with you to use any remaining influence you have over your former company to press them to lower the price of these drugs. You can look away if you like, but I wish you could see the faces of people, no matter what Ms. Retzlaff says, who cannot get the drugs.
Now, justice was served, but in another fashion. The CEO, Mr. Shkreli, was convicted on 2 counts of securities fraud and sent to 7 years in prison. The price of Daraprim, however, has never lowered. All of this seems to point to the fact that Big Pharma has got the U.S. public in a position of weakness. For someone infected with HIV, Truvada could be life or death. Needless to say, people in such circumstances are pretty ripe for being gouged. But this raises a bigger question. How much freedom should influential corporations have, especially when they are receiving so much government assistance in order to do their work? Caleb Maupin, RT, New York.